Gluten-free dieting is something that everybody has become more and more and more aware of. In the last 10 years, I did a lot of treatment for autistic children. And one of the big parts of treating autistic kids is getting on a gluten-free diet. Gluten-free means there's a specific protein that occurs in wheat especially, and other wheat kind of products like spelt and rye and other grains. And gluten, it does something in terms of its structure to stimulate the brain and the intestinal tract to get very, very irritated. Lots of people who have celiac disease have a gluten problem that's enormous. They'll eat some wheat or bread, or they'll eat a cake or something, and they'll get horribly sick. They'll get diarrhea, and they'll have headaches, and headache. Well, why would they have a headache? Weird, huh? Because gluten affects the intestinal tract exactly the same as it does the brain. Because the brain and the intestinal tract came from the same strip. When you were developing as an embryo, when you were just first conceived, that same strip created the intestinal tract and the brain. So the way that molecules like gluten affect them are exactly the same. If you have some irritability, could it be grain? Who would have thunk it? Well, you can think it because gluten, it's really easy to get your arms around this idea. If you have irritability, if you're a little depressed, if you're a little bit sleepless, could that be a gluten sensitivity? Sure. Could I do a blood test and prove it? Probably. Do you need one? No, just avoid gluten. This is a really easy, inexpensive way to really revolutionize your health. From what I'm seeing in my practice and just clinically in my experience, probably more than half the people I see will do better off of gluten. Isn't that crazy? So all the bread that's available has gluten in it unless it says gluten-free. Easy to find, it says gluten-free. It's not as satisfying. Gluten is like glue, and it kind of holds things together. So what gives bread that nice, chewy, yummy consistency is gluten. There's other types of gluten that come from different grains, like garbanzo bean and other things that people use that make bread taste awesome. It's a little bit more expensive. But if you had any kind of health problem that it's kind of nebulous, you got joint pain, headaches, kind of nobody can really figure it out, think about gluten-free, because it's almost free to change your mind about gluten-free. You can actually just change your diet, take the gluten out. It takes usually about 6 to 8 weeks to get the full benefit, but take the gluten out of your diet and pay attention if your headaches don't get less, your joint pain doesn't get less. People tolerate you better because you're not quite so irritable. And gluten-free dieting isn't just for people who get sick with their intestinal tract, with celiac disease. Gluten-free dieting is for everyone to try and see if it doesn't improve their health. Your doctor can do lots of testing. They can do blood testing for antibodies. They can do stool testing for antibodies. They can do more sophisticated testing that involves gastroenterology and things like that, but that's way down the line. And if you ever have any question that needs those kinds of answers, your doctor's great to work with. Immune specialists, sometimes pediatricians and gastroenterologists are the best at that. And remember, with all of this stuff, if you have questions, always get with your doctor, because we're better together.